Injections for knee osteoarthritis, OA, a comprehensive guide to cortisone, hyaluronic acid, and PRP therapies. If you came here to treat your knee osteoarthritis before it gets too bad, you came to the right place. Hi, it's Daniel from Supply PT, where we help people get back in motion. If you are new here, please go ahead and click that subscribe button and all the links to everything we mentioned in the video, which you can find linked in the description box below. Now let's jump right into it. Knee osteoarthritis, OA, is a progressive joint condition characterized by the gradual breakdown of cartilage, resulting in pain, stiffness, and reduced mobility. While no cure exists for OA, several injection therapies are available to manage symptoms, improve function, and potentially slow disease progression. Among the most common options are corticosteroid injections, hyaluronic acid HA injections, and platelet-rich plasma PRP therapy. Each treatment offers distinct mechanisms of action, benefits, and risks, making it essential to tailor therapy to the individual needs of patients. Corticosteroid injections. Corticosteroid injections alleviate inflammation and pain by delivering synthetic cortisol, a hormone that suppresses immune activity in the joint. This provides rapid relief from acute symptoms. Short-term relief. Symptom relief usually lasts 4 to 6 weeks, making corticosteroids ideal for managing acute flare-ups or bridging to other treatments. Despite their effectiveness in the short term, corticosteroid injections pose significant risks with repeated use, accelerated disease progression. Studies suggest an increased risk of OA progression, cartilage loss, and joint space narrowing within 2 years, osseous and soft tissue damage. Corticosteroids may cause bone damage, subchondral fractures, or ligament instability. Increased risk of joint replacement. Prolonged use raises the likelihood of requiring knee replacement surgery. Infection risk. Timing of surgery after injections is crucial, as infection risk is higher if surgery occurs within 3 months. Corticosteroids are most appropriate for short-term relief in cases of acute inflammation, but should be used cautiously due to their potential to accelerate OA progression. Hyaluronic acid injections. Hyaluronic acid, a key component of joint fluid, provides lubrication and cushioning for the knee joint. In OA, HA levels diminish, contributing to pain and stiffness. HA injections aim to restore these functions and potentially reduce inflammation. Pain relief duration. Symptom relief can last up to 24 weeks, particularly in mild to moderate OA. Disease modulation. Some evidence suggests HA injections may slow OA progression, delaying knee arthroplasty by an average of 3.6 years. Unlike corticosteroids, HA injections may preserve cartilage and joint function, making them a safer option for long-term management. Patients in the early to moderate stages of OA who wish to avoid surgery and seek sustained symptom relief are ideal candidates for HA therapy. Platelet-rich plasma injections. PRP therapy involves concentrating platelets and growth factors from a patient's own blood. These growth factors promote tissue repair, reduce inflammation, and may stimulate cartilage regeneration, addressing OA at its source. Durable relief. PRP effects often last 6 to 12 months, offering longer-lasting relief than corticosteroids or HA. Regenerative potential. PRP may slow OA progression by promoting tissue healing. Variable efficacy. Outcomes depend on factors like disease stage, age, and PRP preparation methods. Advanced OA. PRP may be less effective in advanced OA with severe cartilage loss. PRP is well tolerated with minimal side effects, such as temporary injection site pain. Unlike corticosteroids, PRP does not accelerate cartilage degradation. PRP is best suited for younger patients with early-stage OA seeking a regenerative approach to treatment. Combination therapy, PRP and HA. Combining PRP and HA offers a synergistic approach that combines the regenerative properties of PRP with HA's lubricating effects. Enhanced symptom relief. Greater pain relief and functional improvement compared to HA alone. Extended duration. Longer lasting results than either treatment individually. Patients with moderate OA who seek optimized pain management and joint function improvement may benefit most from this combination therapy. Conclusion. Injectable therapies play a vital role in managing knee osteoarthritis, offering diverse benefits based on patient-specific factors. Corticosteroids are effective for short-term relief, but carry significant long-term risks. Hyaluronic acid injections provide sustained symptom relief and may slow disease progression. Platelet-rich plasma offers regenerative potential, making it an attractive option for younger patients or those in early disease stages. Combination therapy with PRP and HA represents a promising innovation for moderate OA management. Choosing the appropriate therapy requires a thorough evaluation of the patient's age, disease severity, and treatment goals. Consulting with a healthcare provider ensures a personalized plan that balances symptom relief with long-term joint health. Thank you for watching this informative video on knee surgery. If you found this helpful, don't forget to hit that like button, comment below if we missed anything that helped you, and more importantly, subscribe to our channel for more healthcare tips and information.